Hey guys, it's Sarah here. In this video, I'm going to be going over leukemia. Go over the differences between AML, CML, etc., and go into leukemia. So let's get started. So what is leukemia? Leukemia is basically cancer of the blood cells. As the name says, leuke is white blood cells, emia is blood, cancer of the blood cells. How is it classified? It's classified by two different ways, either by the type of cell or by the acuity. So in terms of the type of cell, we have what we're talking about here is the lymphoid cells or the myeloid cells. If it starts with the lymphoid cells, then it's lymphocytic. If it starts with the myeloid cells, then it's myeloid. So it's pretty simple. It just depends on where the cancer starts. The other way is how quickly it spreads. So is it acute or chronic? Acute is rapidly growing. Chronic is slow growing. Acute usually happens in days to weeks. Chronic is usually months to years. So that's basically pretty simple. You just basically take one and match them up. So for instance, ALL. ALL stands for acute lymphocytic leukemia. So it's acute. So that's from one category, acute. It's rapidly growing. And what type of cell is it? Lymphocytic. So it's from the lymphoid cell. So that's the type of cell. So it's basically just picking it. So pick what type of cell it is, pick how fast it is, and then you got your cancer. So now a little background to leukemia. All blood cells are made in the bone marrow. The bone marrow is basically like a spongy material in the center of the bone. The blood cells are made there. So if there's going to be a proliferation of one type, there's going to be no room for the other type. If I say in this elevator, there can only be up to 500 pounds, and then one person comes in at 400 pounds, you only have 100 more pounds for someone to come in. As opposed to if everyone weighs 60 pounds, you could fit a lot more people in it. So with the bone marrow, there only is X amount of space in it. So when cancer is a proliferation of the cell, when there's a proliferation and there's too much of it rapidly growing, the other ones are going to go down. So what are the other ones? We have white blood cells, which we know about, which fight against infection. We have red blood cells, which carry oxygen to the tissues. And we have platelets, which are involved in clotting to prevent bleeding. So these are basically the symptoms that you're going to see. Because if the white blood cells are proliferating, you're going to have less of the red blood cells and less of the platelets. So that's going to be your symptoms. So your symptoms of leukemia, besides for constitutional symptoms like flu-like symptoms, fever, your symptoms are going to be specific to the decrease in the red blood cells, so the fatigue, the anemia, the decrease in the platelets, the bruising, the bleeding. They also could have bone pain because if you remember, like we just said, the blood cells are made in the bone marrow. Where the cancer is starting to proliferate is in the bone marrow. So you're gonna have bone pain. So those are basically your symptoms. Flu-like symptoms, like fever, etc., fatigue, bruising, bleeding, bone pain, etc. So what are the causes of leukemia? The causes of leukemia, so with leukemia, there could be like a chromosomal translocation like 9 and 12, which is the Philadelphia chromosome, but it also could just be from regular stuff that could cause increased your risk for any cancer like radiation, exposure, etc. In terms of how it's diagnosed, so other stuff could clue you in, like elevated white blood cell, decrease in the other blood cells, platelets, red blood cells, etc. But to actually diagnose it, you do need a biopsy. Now treatment, it would depend on what type and if it's acute and chronic, but generally chemo, radiation, stem cell, target cell, etc. And then again, it depends if it's acute or chronic. Acute is more aggressively treated, chronic is less because it's slower growing. So that's pretty much it. To sum it up, leukemia is cancer of the blood cells. In terms of classifying them, they could be classified by the type of cell, either lymphoid cell or myeloid cell, and classified by the acuity. Is it acute or chronic? Is it slow growing or fast? And we also said that the blood cells are made in the bone marrow. If one proliferates, there's not much room for the other one. So you're going to see symptoms of that. You're going to see anemia. You're going to see bruising, bleeding. You're going to see fatigue. You're going to see bone pain because that's where it's starting from. In terms of diagnosis, you always want a biopsy to confirm. And the treatment would be a treatment for like any other cancer, but it would be individualized and specific to what type of cancer they have. If you have any questions, then ask in the comment section below, and thank you for watching.